So healthcare is one of the biggest sector today, but highly disorganized and very, very expensive. What if you could put the healthcare sector on the blockchain and reduce the administrative cost? And this is what exactly Solve.Care is trying to do, wherein the control goes back to the patients, to the consumers, from the doctors and the hospital. So let's go ahead and find out what exactly Solve.Care is. What I really like about this team is the main lead of the Solve.Care, which is Pradeep Goel. He has about 27 years of experience into healthcare. He was also a part of the Obama administration in US and Bush administration in US during the health campaign out there. He was building up some products. Of course, he's built several products into health sector, have about 27 years of experience. Now, before we begin, I do want to mention that this isn't a sponsored video, but however, I do have right to share my personal opinion. Honestly, I do find it very legit and I am quite bullish on this project, right? Now, however, this is not an investment or financial advice. I would request you, in fact, to go ahead and do your own research and decide it for yourself before you choose to take a part in this ICO. But in this video today, we're just going to go through and understand what exactly Solve.Care is trying to do and what problem are they solving, right? So let's begin. So here it is. So healthcare on blockchain, global blockchain solution for coordination, administration, and payments of healthcare. So they have a white paper, of course, here. We'll come back to the white paper, but let's have a look at the team first, what we are talking about. Of course, how they are trying to merge the patients and the doctor and the hospitals. Everything is right on the first page. But if you really want to understand what Solve.Care is, and if you have questions like how is it going to work, how the doctors are going to contact patients and how the patients are going to doctor, how the insurance companies are going to take part, there's an AMA here. So it's a Solve.Care AMA session. What I found, really, this is about 35 minutes of AMA, and almost all the questions that an individual might have has been answered. That how does a doctor approach patient, or how does a patient pays their fee, how does a patient approach the insurance company? All the questions are being answered here. By the way, they have also been reviewed by the Crush Crypto. It's one of the channel that I really like. If you have any ICO that you really want to go through and want to understand, I think Crush Crypto is one of those channels really does good ICOs review. So they have been reviewed by ICO Crush Crypto as well, and this is the white paper. But let's go ahead. Before we jump onto what exactly product are they building, I want to actually take you through Pradeep Goel's experience. So Pradeep Goel, who is the Chief Executive Officer, and this is what I found interesting, that except Pradeep Goel, there's no one. So Pradeep Goel is, by the way, an Indian guy, but of course has lived in US and built several products in US. But rest of the team you will find are just one Indian guy out here, which is great. A couple of them actually. So let's have a look at Pradeep Goel. Sorry. So Pradeep has deep expertise in health and human services, finance and technology. He has been in the CEO, COO, CIO, and CTO roles at the various innovative technology for more than 25 years. Pradeep has deeply involved in designing and building solutions for several public programs such as Medicaid, Children Health Insurance, Medicare, SNAP, and of course, if you see here, it talks about he has worked for and with insurance companies, employer-sponsored benefits, and US government programs. So this guy has worked for the US government program, and you will find that in this video today, where he mentions that he worked under Obama administration and Bush administration for these health campaign, right? Right here, to healthcare benefits and financial administration. And this is what you really look out for whenever you consider for ICO. You really look at the leadership team. What have they done? Who is it led by, right? And by the way, they have also done some partnerships already. For example, they have done a partnership with Arizona Medical Center. Let me have a look, and then we go through the main website, right? over here, recent acquisition. Solve.Care has acquired UKR Soft, a long-standing research and development partner. 17 years of research and development, deployment, maintenance of enterprise. Our partners, these are the partners, and let me also, they have also have a YouTube channel, by the way. One of the things that I really liked about Solve.Care is they have been attending several conferences. So for example, if you watch this interview, which is this guy, this was basically a NASDAQ. If you see the background, it's NASDAQ, but this was a live from FinTech World's Blue Chip ICOs Roadshow in Harvard Club in New York City.
A scenario, I get the flu's going around. I want to go to a doctor. Tell me how I can use Solve.Care soup to nuts, from getting the flu to getting better.
Great question. So you would have a care wallet issued by your employer or by insurance company.
Exactly. So in this video, you can go ahead and watch it yourself. This video, he explains how the Solve.Care is going to be used, right? In a simple way. Now let's go onto the website and let's find out how does it exactly work. So Solve.Care makes healthcare affordable and easy for everyone. So Solve.Care platform utilizes blockchain technology to reduce the enormous global clinical and IT system cost associated with our current healthcare system. This revolutionary platform, along with its vast components, is available to all parties involved and creates for far-reaching timeless benefits. So how does it work? How does it work for the patients? How does it work for the employers? How does it work for the doctors and hospitals? And how does it work for the administration and insurance? Because that's the whole purpose of Solve.Care, to reduce the cost, to make the whole healthcare process simple, right? So here it is. So patients can make instant appointment with any doctor, understand your insurance. They can understand your insurance, 24/7 access to healthcare benefits, review and pay bills with the help of CAM tokens. And they also have a care wallet. Employers, if there's a hospital who wants to pay to their employees, administrative benefits, reduce healthcare costs, reward employees. At the same time, for the doctors, to handle appointment, issue prescriptions, coordinate with the specialist, access to accurate records. So your record is also stored onto the blockchain itself so that it never gets deleted, administrated and insured, right? So basically getting all these four important elements of the healthcare industry together: patients, employers, doctors and administrators. So care.wallet in action. You can download this on the phone. And Solve.Care solution changes the way the healthcare works for everyone. So here's the connection: doctor, patient, insurance, doctor, insurer, insured, employee, agency, citizen, right? So pretty much everything defined over here. Consent, scheduling, treatment, right? Cards allows exchange of consent for treatments, records, billing, payment, emergency, compliance, and many more scenarios. This is the roadmap, which is again pretty much defined. They started the work of Solve.Care in 2014-2016, so that's a pretty long time, and that's something that you always look at, that how long they have been building the project before actually they are doing an ICO. By the way, there are only 6 days left for the ICO, guys, right? And they've also been featured on bitcoinexchangeguide.com. That's an ICO review. So this is the roadmap in short. Wow. So they had a private sale in Q4 2017. Solve.Care signed first commercial customers with more than 250,000 clients. This is the token sale launch, and this is the roadmap. So Q2 2019 is going to be insurance ID card with built-in plan benefits, provided payment via care community published. Right, this is the leadership team which we have already spoken about. There are 50 plus dedicated people who are working on Solve.Care, and these are the press media that they have been featured on: Chiplane, Fin News, Wall Street Journal. So yes, they are all over the place, right? Of course, you can also join their Telegram channel, and you can like them on Facebook, Twitter handle, LinkedIn, YouTube video. You can also look at the code for GitHub as well, right? So now one thing that I want to show you is the partnership, which I found very interesting. Yes, this one. So our clients, Arizona Care Network. Arizona Care Network is physician-led and governed accountable care organization of more than 5,500 clinics. So this is definitely headed by the governments, right? of course, this is a regulated company already. So they are already tied up with Arizona Care Center. And of course, they aim to be the global farm. They aim to be the global, this solve this problem globally, not just in, of course, the product goes live. So you will see this notification when you're on the website. You will see this notification which will pop up here. So pretty helpful. In case you are interested, you can go ahead and click on buy tokens. There are certain information that it needs, like your name, address. I think you just need to put email and all that, and then next, and that's how you can participate. I think it's about 10 cents per token is what this is priced at. Let's have a look. Yeah, token price is about 10 cents. Method, Ethereum, BTC, 350 million tokens. And they have also given a breakup of how the whole token is going to be used over here. Token allocations. 18% is reserved for team. You really want to know how much is for the team, how much is for the expenses, how much is for the community, how much is for the admin cost, right? So the clear allocation of how the tokens funds are going to be utilized. And you definitely need a clarity here for the project to be sustainable in the long term. So what are the drawbacks? The only thing that I see, that how are they going to implement it? How are they going to implement it all across the globe? Of course, but what I really liked about is the experience of the main leader, who already has about 27 years of experience into healthcare industry. So definitely leave your opinion in the comment box. Definitely go through the white paper, definitely go through the team, do your own research. Let me know in the comment box below, what do you think about Solve.Care? Thank you so much for watching, guys. Give this video a like and subscribe if you're new, and I will see you in the next video.